I've had pain in my knees for as long as I can remember. I went to doctors in the past. I had family members that had knee pain, and I just figured I had bad knees. And I just kind of plowed through it. As I got older, it started getting progressively worse. I was doing a hike in Costa Rica with my daughter, and I made it a little ways, and I had to come back down because I was in so much pain. And it prompted me to go and seek medical help. Like I knew something was, much greater than just knee pain. And this is where I was connected with Dr. Avino. And he went beyond my knees, and they discovered that I had hip dysplasia.
Jennifer was diagnosed with hip dysplasia, which means she has an abnormality in the hip that predisposes her to developing arthritis at a young age. Over time, this arthritis can progress and cause increased pain and limit mobility and function and may interfere with activities of daily living, which is when we decided to proceed with hip surgery.
And Dr. Avino said that he couldn't guarantee my hips were going to last another year. So it was shocking. The only treatment I could have that was going to be able to take away my pain was the bilateral hip replacement.
So we recommended the Mako robotic procedure via the direct anterior approach because it's a less invasive surgery. What this means for patients is they feel less pain after surgery. They're able to get back to their activities a little bit quicker than traditional surgery. For patients like Jennifer, I often perform what's called a bikini incision, which helps with wound healing and provides a more cosmetic appearing scar. Mako, or robotic surgery, is particularly helpful for patients with hip dysplasia because the anatomy is different than the normal hip joint.
So with the Mako, he explained to me that he would be able to gear the surgery towards my specific anatomy. And with that, you have better results, long-lasting results, which me being only 51 years old at the time, I need this to last.
The Mako system uses a preoperative CT scan, which helps create a 3D model of the hip, allowing me to plan the surgery before I even enter the operating room. Without precise preoperative planning, there may be a higher risk of complications such as a dislocation or leg length discrepancy following surgery.
Fresh out of surgery, the physical therapist came and I was on a walker walking. I found it fantastic that I was walking right away after the surgery. My recovery was fantastic. And I was ready to go in 3 months to have that second hip done. I wasn't nervous. In fact, I was excited because if I felt this good with this hip, I was going to feel a million times better having my other hip done. For the pre-op, it was one-on-one care. She sat down with me and explained everything to me.
In my role as the orthopedic nurse navigator, I guide patients from pre-op to recovery. So with Jennifer, she was capable of doing it twice. That makes me very proud and is really a testament to her and the team.
At Palm Beach Gardens Medical Center, we've built a program that combines robotic technology, advanced surgical techniques, and a dedicated team of specialists who truly care about our patients and their outcomes. It's a privilege to be a part of a hospital that's leading the way in modern joint replacement and helping patients get back to doing what they love.
I was in so much pain that all of my energy was going towards my pain. It wasn't allowing me to do all of the things I love about Florida and being outdoors and being active. I knew I was in the greatest hands with Dr. Avino, the best care with Palm Beach Gardens Medical Center, and now I feel better than ever, and I owe my quality of life to them. I feel like a new person. I feel like almost a kid again.